Welcome to Care Talk, your home sweet home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, it's been 2 weeks since we spoke, and there's so much to talk about. We're going to talk about meat plants. We're going to talk about security. We're going to talk about emergency rooms and maybe telehealth if we have time. So let's jump right in. John, here's my question for you. Where's the beef? Is it right to have the president force the meat plants to resume production?
Well, let's be honest. He's actually doing the right thing if he is defending our food supply chain. And that's got two dimensions. One is the actual risks to it, and the other is the fear that it might be disrupted, because that fear could lead to hysteria, even if it's unfounded. So that points to the president on that. But let's be serious. There's plenty of meat and there's plenty of food. And maybe another role he might want to play is to reassure people that the supply chain is secure.
Well, John, that's right. It's kind of ironic that, he invoked the Defense Production Act not to make masks and not at first to make ventilators, but to make sure that we've got pork and beef coming in. And as you pointed out, these workers are actually only asking for unpaid leave, and that's being denied. I think if we go back to wartime, which we're talking about here in the context of COVID-19, there's a famous lesson from Norway during World War II when the Nazis stole all their livestock, and the death rates from heart disease plummeted. And then when the supply was restored, the high levels came right back.
David, you're pushing a vegan agenda. The fact is that mortality rates did fall when the Nazis shifted all the meat to Germany. But the bigger point here is that the essential workers need to be protected. We need to treat them with support around paid leave and PPE and affordable health care as we do, firemen and policemen. They're just as essential. And that's the part that I think we're really missing. And you can leave your vegetarian agenda back in Boston.
All right, John. Well, I'll try to beef up my talking points next time. Now, John, I should apologize to you because I said, it's been a couple of weeks since we spoke. And when we did, I really liked your point that public health after COVID-19 is going to be like security after 9/11. So I took the liberty of writing about it since then. But I want you to explain. What the heck are you talking about?
Well, I suppose this is probably going to end up in another one of your blog posts. But I think the thing to think about is that it was impossible to imagine the security requirements, whether it is research or oversight or travel, prior to 9/11, what we've gone through afterwards. And we went through this huge sense of being vulnerable. We figured it out. We've prevented other things happening, but we've invested probably hundreds of billions of dollars to make sure our country is secure. I think we're going to be doing the same thing. This is an invisible enemy that's just as dangerous. Whether it is organic through a that's naturally occurring, or honestly, the vulnerability to a engineered weapon from bad guys who could genetically engineer a virus. We need to now realize that we are going in the COVID and post-COVID world. We've got to build the infrastructure to test, track, and contain viruses like these at scale. And we have to really invest in public health infrastructure in a way we never had before. In the same way we needed to make our borders secure and our homes secure from terrorism, we're going to have to do the same thing in terms of security against viruses.
Well, John, I like your optimistic take on it. I do have a concern that what will happen is we may go in the wrong direction and may focus a little bit more on the xenophobic elements, keeping the foreigners out, any foreigner is a bad guy, and that we may have that this surveillance that we need for things like contact tracing may actually lead to too much surveillance and oversight. I think we have to keep an eye on that right from the get-go.
I think that's right, but I think that we will live with more surveillance because it'll protect more lives. But there's no question, David, we're going to have more surveillance and tracing because we need to. And honestly, the public leaders need to make that case. One of the reasons why I think we still fight a bit over the post 9/11 things like the Patriot Act and surveillance is because we didn't have an open conversation about what the value of it was and where the limits should be. But we will be investing in more public health infrastructure. And we've got to make sure that we don't invest on it in a way that ignores the question of the need for paid sick leave, the need for affordable healthcare coverage, because it's those essential workers who don't have enough coverage who are most vulnerable to the target like of this kind of virus. And so, but I agree with you. I think we're going to have to have those conversations, and I think you're seeing it happen faster in places like Germany, but how they actually meet in the middle to protect individual liberties and provide the national tracking and tracing that allows you to contain what would otherwise be a forest fire into just like a campfire.
That sounds good, John. Got any questions for me?
I guess the ironic question is, what do you think is going to happen to all this healthcare utilization that's been deferred? I mean, the ER use has gone way down. Elective surgery has gone way down. Does this mean a lot more people are going to be sick and our healthcare costs are going to boom in the rest of the year and people are going to suffer?
John, I'm sure people will suffer. They're suffering now. I mean, it wasn't any surprise that the elective surgeries dropped because the hospitals canceled them. But I don't think they were expecting the heart attacks and the strokes to go down as well. And they have the visits to the emergency room anyway. I think there's a couple of reasons for it. This sort of speculation. One thing is just things tend to resolve on their own. Not everything, but if people wait, which they're doing now, they may find out, time cures it or makes it better. And then I think there's a lot of success with things like, physician's office or telehealth or just working on things at home. This is a concern, I think, for hospitals because the ER is the entry point to the hospital for hospital admission. That's how hospitals make their money. One thing that's going on gives us a chance to study these things. I'm encouraged that I know there's a Datavant led initiative to bring a lot of data sets together so we can actually study these things and make some better public policy choices going forward. And John, I have to say that I do think the answer for some of these things is actually going to benefit, the field that you specialize in, which is really care outside of the four walls of these institutions.
Well, there's no question that getting people home, keeping them home, allowing more people to heal and age at home, which is exactly what we focus on at CareCentrix, is going to be a winner in the post-COVID environment because how dangerous hospitals and nursing homes can be when you've got an infection. But many people don't realize that it's one of the fastest growing reasons for mortality in America is a recent visit to the hospital. But I think that the data actually shows, David, you don't have to look very far to realize that when elective surgeries fall, mortality actually falls as well. That's been true in Israel, in Los Angeles. Every time when there have been strikes and they've been deferred, there's either been the same health or better health. But I want to ask another question about this telehealth thing. It is rapidly expanded. 80% of visits in the last month had been done, to the extent there exist at all, via telehealth. Do you think that's going to continue? What's going to happen there?
I mean, John, you and I talked about this. We've been following telehealth, you and I, for at least 20 years, and there was more progress in 1 week than there had been in the previous decade. I don't think that's an exaggeration. And I mean, I'll take the argument that it's actually going to snap back a bit. Because I think what will happen is the providers will get back and they'll say, you know what, I want to boost utilization to make up for my lost time. I miss seeing my patients. Patients want to see me. I actually can make more money when the patients come in because I can order tests and things for them to do. And reimbursement right now, the plans are giving away the store. They're making it just as lucrative to do a telehealth visit as an in-person visit. I think that'll snap back as the plans try to save money. So I'm going to take the negative viewpoint on there, John.
So finally, we found something we can argue about.
John, I enjoy arguing with you. I mean, I actually think the slightly more nuanced. I really only like yes and no answers, but there's a kind of a hybridization here that I think is going to go on. They're going to figure out the things that you need to do in person, focus on that in the office. But if you don't need to come in, do it remotely. And that's really the way that it should be. This gives us a chance to figure out what can be done remotely, and then the rest will come in for. Well, John, maybe to close things out, I know everybody's sort of sheltering with their families at home and not clobbering each other, hopefully. My son asks me sometimes for a rose and a thorn for the day or for the week. You've got any hope to offer us or any thorn you want to talk about?
I think let's focus on gratitude, David. There's a lot of what's wrong in the world is pretty darn clear, but we can all be grateful to spend more time with our family. And I think most of us can be pretty grateful about the fact that there's some beauty in slowing down a bit. And while this was forced upon us, looking for the things to be happy about, looking for reminding yourself with all the inconvenience about the rose, that's important. What about you?
I'll take the positive view here too, John. I mean, I would say that, as the tide has gone out on things like healthcare utilization and even on, air pollution and kind of, wild travel, it gives us a chance to think about what do we want to return to when we have that opportunity. So I think we should make the most of this forced time away and make it happen. Well, that's it for another edition of Care Talk. I'm David Williams from Health Business Group.
And I'm John Driscoll from CareCentrix. Thanks for listening.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.